I think it's become very clear to everybody in this room over the last few days that communicating the results of what we do is extremely important. It was really interesting to see that as an emerging theme this year. But communication as a whole is something that in the public health space is really becoming a lot more critical. So, you know, when we're responding to an outbreak of infectious disease, and really a lot of this conference is about responding to outbreaks and disease events, lab capacity is going to be a huge part, sequencing, informatics, how we deal with data. But yeah, there are other aspects to having a really good, robust health response. And one of those aspects is having a really solid communications platform. So the field is starting to recognize that building communication capacity around the world is really an integral part of preparing for detecting, and responding to infectious disease threats. And it's so important that it is actually mandated by the WHO. If you look in the international health regulations, which are sort of the set of core capacities that WHO member states need to fulfill when it comes to public health, communications is actually one of those core capacities. Countries are expected to be able to do real-time exchange of information, of advice, of expert opinion between experts, between officials, between citizens of a country that are facing a public health threat. This is a requirement of the WHO. But despite it being a requirement, only about 2/3 of the WHO member states, the IHR signatories, only 2/3 of them are actually compliant with that and actually have really good communications capacity. And I think the lack of that capacity was really, really evident during the 2013 to 2015 West Africa Ebola epidemic. There was really a lack of communication infrastructure there. There was a lack of messages, key messages being transmitted to the community early in the outbreak, a lack of information being sent back from the community to responders, and that really amplified the problem in the early days and prevented some solutions from really floating to the forefront. Communicating in outbreaks, especially an outbreak like Ebola, is really challenging, even if you are a seasoned professional, because you're trying to reach multiple audiences. Each of those audiences has different needs, has different ideas about what's important. They get their information and news through different routes. They all have different lenses and perspectives through which they view their communications. And you have this weird balance between trying to be effective in your communication, but also not scaring people. And you want to get out there ahead of messages, but at the same time, you don't want to be caught crying wolf. And you're also having to work in a very interdisciplinary space. Communications is really the intersection of research and practice and biomedicine and social sciences and behavioral sciences. So it's a really tough space to navigate. But we have a seasoned professional who has done this many times before to talk us through what communicating in the infectious disease landscape, in the public health world, in the global health world looks like. So Gabby Stern is here with us today. She is currently the Director of Communications at the World Health Organization. She's based at WHO headquarters in Geneva, and she is in charge of the organization's global communications strategy. She manages a team of communications professionals, and she's the spokesperson for the Director General. So if you shake her hand, you'll be this close to the WHO DG. But everybody washes their hands here, so it's safe. I know her from my life at the Gates Foundation because prior to joining WHO in March of this year, she had spent 3 years at the Gates Foundation, and she was the Director of Media and External Relations. Before that, though, Gabby was a journalist. She did her bachelor's and master's degrees at Yale. She worked for the Omaha World Herald, and then she spent almost 25 years at the Wall Street Journal in various editing, reporting roles all around the globe, US, Asia, London, and she's here with us today to talk communications. So join me in welcoming Gabby Stern to the stage. So how this session is going to unfold is I'm going to start with a few questions. I used to do loads of science journalism in Canada, so I love talking and interviewing people. But then we're going to open it up to the floor later. We've got about 40 minutes or so for this conversation. So think of questions you might want to ask. Again, you can put them on the Slido platform. I'll be able to check them from here. But yeah, let's dive right in. So our audience, many of whom you had the chance to meet over dinner last night, is a real real mix of backgrounds. There are people from public health, there's people from computer science, there's some clinicians, there's bioinformaticians, there are mathematicians. Everybody in this room took a really different journey to get to where they are today. And I want to hear a bit about what your career journey was like, and in particular, how did you jump from journalism into the health communications space?
So, oh, good, it's on. So thanks for having me. Thanks for listening. I realize I stand between you and lunch or your weekends. So my journey began, well, I was a journalist from the age of 11. When I was 11, I was at a school in Morristown, New Jersey called the Peck School. And the school newspaper was called the Newspecker, really. And I started writing, and I eventually was the editor in 8th grade. And so I was a journalist, and I think in many ways I still am. That's who I am. I always will be. But I was reaching my 25-year anniversary at the Wall Street Journal. I was turning 55, and I was feeling stale and irrelevant. I was very high. I was on the masthead. I was a deputy managing editor. I was doing strategic initiatives, and I felt that I wasn't making a difference anymore. And I thought, there's nothing else in the world I can do but journalism or communications. So I thought, let's see who will have me. And the Gates Foundation hired me, so I jumped. And I moved to Seattle. At the time, I was based in New York for the Journal. So we picked up sticks, we moved to Seattle, and I really learned the field of global health communications at Gates from wonderful colleagues. Then WHO needed a director of communications. And at Gates, I was doing media, I had writers, I was doing reputation issues and so on. But at WHO, I could have the full panoply of communications, internal, external, social, media, writing, digital, and so on. So I thought, okay, that's the logical next step. And plus, I thought, WHO has a relatively new director general, Dr. Tedros, who's super interesting. He's an incredible blend of head and heart, and he's also trying to transform WHO, modernize it, bring a more scientific rigor to it, and so on. So I thought, okay, this is the next job for me. So I left Gates a couple months ago, jumped in at WHO, and of course, we have the Ebola outbreak, but I also am transforming a communications department as part of the broader reorg. I'm trying to strengthen it, and also really take the talent we have, and we have really talented people, and just sort of empower them in a way that they haven't been for a while, because there was no head of communications for 18 months. They had a wonderful acting head, but they didn't have long-term leadership. So that's my story. Just on a personal level, I am married. My husband is either in the room or back at our room, and he was a trailing spouse. He really supported me throughout my career. He was the main caregiver for our children, who are now grown up. One is studying electrical engineering. He's a junior at a college in the US, and our daughter lives and works in London because we're dual citizens. And she's actually in global health, advocacy and communications, like me.
I think a bunch of people here would probably be curious as to what a typical, I hate this typical day in the life, because there's never a typical day, but let's describe some of the typical activities that might unfold in a week in your role at the WHO.
So every day is a week.
Yeah.
Every week is a month. Seriously, I'm a workaholic. I've never worked this hard in my life. And I think it's because of the outbreak. I mean, I think because WHO does so much, and we're scrutinized by member states, by everybody, it's a really, really big, it's a heavy lift. But the Ebola outbreak has added a layer of everything. And so, for instance, the last 24 hours, let's just talk Ebola. We have a high level of media interest in the outbreak. And we just want to tell reporters whatever they want to know, and there are things we want them to know. And we want reporters to go to the field. We want them in Butembo and Beni and Katwa and everywhere. So my team and I are facilitating their trips into the field, which sometimes is difficult because they have to get permission from the Ministry of Health, and that could be tricky. And then we had, for instance, Dr. Mike Ryan, who's our head of emergencies. He gave a press briefing yesterday, and that had a lot of follow-up questions. It was interesting that the media, it was sort of like a smorgasbord. Every journalist, it was a teleconference with international media, and each news outlet took a different thing from what he said, which is super interesting to see. We're also trying to now plan, the outbreak is not going to end anytime soon, so I'm now in charge of shifting resources into it for the long term, getting through the summer months when everyone will be on vacation, then backfilling because we can't just communicate about Ebola. There are other things happening in the world. So, at any given time, I have 1 million Ebola-related things. Then, meantime, we put out some interesting statistics yesterday or the day before about sexually transmitted infections. Not a good story. The 4 major infections are not going down. Today is World Food Safety Day, the first ever. So we're trying to communicate a lot about food safety because it's a growing issue. Yesterday or the day before was World Environment Day, and of course we're interested in the environmental determinants of health issues. I mean, every day, every minute, it's something else. It's quite incredible.
A lot more interesting than most of our days.
So this is why I have gray hair. My hair, no, it's actually not.
I love it. It's got to be a particularly stressful time to be working in communication. Ebola outbreak aside, this is a time where I think we as a community obviously recognize the importance of communication capacity, and we've got this unparalleled ability to reach people through social media and channels that we just haven't ever used before. But at the same time, we keep hearing, I always hate this word, but I'll say it anyway, fake news, and then things like vaccine hesitancy. We saw in this Ebola outbreak and the last one how quickly rumors and misinformation stand. What's your perspective on some of the opportunities, but also some of the challenges in that current health communications landscape?
So, in many ways, this is the best era ever to be doing communications about anything, right? Because you have digital and you can transmit messages instantly everywhere. And the tools you have, data visualization, interactives, video, I mean, it's great. In the old days, when I was coming up, all you had was, a newspaper, and you had somebody who put the newspaper on your front porch. I mean, and then you had television, fine, and radio. But today, it's incredible. And there's incredible reporting happening across, everything. There are great journalists out there, and the journalism. I mean, when you look at the prizes that people are winning and the coverage of the Trump administration, of Brexit, of the work that the 2 Reuters reporters in Myanmar were doing that got them locked up and thankfully released. Everywhere in the world there's great journalism. However, it's also the most fraught, messiest, perilous period for journalism and for communications, precisely because the advent of the social media platforms has created a level not just of noise, but of disinformation. And it's scary, and it's disturbing, and it's hard to understand how we're going to get a grip on it. And the platforms have to be involved, and I sense that they are coming to realize that they have a responsibility. And in fact, in 2 weeks, there's a convening in New York of the major platforms, Facebook, even Pinterest, Twitter, Google will be there, and others, and we're sending some people. And this is focused on vaccine hesitancy and the anti-vax problem. So it's really difficult. And the other difficulty is there's so much stuff pumping through the social media channels that to get your message across, one's message across, is harder than ever. There's so much noise, so you kind of have to be in there pounding the drum. And then we ourselves, in the communications field, we sort of step on ourselves because, as I mentioned, today is World Food Safety Day. But, at the same time, we're also communicating about many other things today, and same thing yesterday. And so we're pumping out lots and lots of stuff. and we're trying to measure the impact, and you know, it's really difficult to see what is to identify what's cutting through and what is kind of just going out there and dissipating and not having an impact.
You know, you mentioned Twitter and social media there, and this conference in particular is absolutely legendary for having an extremely good social media presence. Like, there's a lot of blue check marks and people with 10,000, 20,000, 30,000 followers in the audience. We do lots of like online engagement, tweeting, live note-taking, all of that stuff. Do you have any advice for folks out here that are using social media? How can they use it better in terms of their scientific career? And why should people that are not using it get on it?
Yeah, I mean, on the one hand, there's a lot of noise on Twitter. And I'm not, you know, I like Twitter. Actually, that's my social media platform of choice, at Gabby Stern. On the other hand, there's a lot of people on Twitter, a lot of people on everything. I think scientists and public health specialists have a real advantage because you actually know things other people don't know. And people are hungry people want to learn. And my advice to you is bring them along. Tell them what you do. Take them on a journey. Don't underestimate them. Don't talk down to them. But do educate them. I mean, as an example, at dinner last night, I was taken on a journey by I hope some of the folks in here, but there was one gentleman who's based in Melbourne, are you here? Who does sequencing around skin infections among indigenous populations in northern Australia. And he told a story that would be very suitable for any social media platform or any media outlet or an event, a field trip for stakeholders that you want to reach, maybe funders. Because these populations are, you know, poor, they're dispossessed, they're marginalized, and they're ill. And I thought that was fascinating, and that's really worthy work. The other group talked to me about badgers and cows. Are you guys here? Yeah? And that was interesting too, which is, why do cows get tuberculosis? And is it because of badgers? This is in England or in the UK. And that was also super interesting, because if I'm the proxy for, let's say, an influencer that you want to, you know, somebody you want to reach to impress them so that they continue to provide taxpayer money to your lab or something like that. You know, that story made me think, wow, this science is really interesting. So I think you are all in an incredibly great position because you know something, you're doing something, you're doers. And so I think you bring your audiences on a journey, and you don't talk down to them, you talk up to them, you educate them, and you learn from them and engage with them on the platforms.
Perfect.
That's my simple advice.
I love it. What can we do in what I described as infectious disease peacetime and in disease outbreak time? Because a lot of us, anybody that's working for a public health agency, knows that, you know, when there's an outbreak, when there's a crisis, it's sort of all hands on deck, and we have to get out some key messages. But what can we do in between those times and what can communications professionals as a whole do to kind of keep the infectious disease communications landscape going, to keep people engaged?
Yeah, it's really hard. There aren't many in-between times, but there are some. But the real problem I encountered at Gates and now at WHO, although we're not in an in-between time right now, but is, you know, so for instance, and you're at Gates and David is here, but, you know, the Gates Foundation is very concerned about the inevitable pandemic flu that will hit, right? So how do you get people really worried and prepared for something that the last time it happened was, what, 1918 in a big way? And it's going to happen, but it isn't happening now, and money needs to be put into research and preparedness, and countries need to have policies in place. And it's a thing that, and so I remember, so Bill gave a speech last April, the Shattuck Lecture in Boston, the Massachusetts Medical Society and EJM thing. And he gave a great talk, and we did a whole lot of media and social media around it, and it was like, yay, people are getting it. But then the world moves on, and preparedness is just not there, and we have to keep bashing away at it, and that's true for all the diseases. It's sort of when you're in a period of absence, everyone becomes complacent. So you have to tell stories. You have to. I mean, even with vaccine hesitancy, one of the issues is in the rich world, people haven't suffered. They haven't seen the effects of some of these diseases, so they become complacent and they say, well, why do we need to vaccinate? So you have to have almost testimonials from people who have experienced diseases, who have experienced crises. But it's very, very difficult, especially now with global geopolitics are very distracting right now, and they're kind of distracting everyone from these fundamental health preparedness issues. And this becomes a problem for our communications department, because when you have political crises in major countries, whether they're in the West or in the global South, and there are plenty of crises to go around, it's very hard to get journalists or even social media followers to pay attention to these longer term issues. Now, I think the climate change movement is doing really well right now. Somehow they have captured people's imaginations. And I also think the oceans plastics movement are doing well. My thinking around that is that they've done something smart to engage young people, children, teenagers, college students, and beyond. And I would be interested to see survey data on why those movements have succeeded, and why is it that global public health hasn't kind of had a surge in engagement the way those other ones have.
Yeah, I wonder, and maybe it's just an issue of connection and people being able to feel closer to the issue. With climate change, we can feel the impacts directly on our lives, and with ocean plastics are something that everybody is surrounded by.
You're on the beach.
You're doing it.
Yeah. In the fall, the IMF World Bank meetings were in Bali, and I had like an hour to go to the beach. And I mean, the last time I lived in Singapore for a while, and we went to Bali a few times, and the beaches were pretty nice back then, and the beaches were full of those Yakult cups. I don't know if you've ever been to resorts, and they have those little yogurt things, and they're like this big, and it was incredibly depressing. So my theory is that climate change and plastics and ocean trash are relevant to to young people in rich countries because they experience that, whereas they are, by and large, experiencing good health. Yeah. So the health problems and the health inequities that aren't visible to them. So to kind of galvanize young people in the West, we have to somehow bring the health inequity problem to them, or bring them to the situations.
I'll finish with one more question before we open it up to the room and online, and it's a career question. So I've seen over the last few years a number of amazing grad students, postdocs, even early career researchers who realize that they want to do something that takes their scientific knowledge but blends it with something else. So you see people that want to do entrepreneurship, for example, and go off and start companies, but I see so many folks that are interested in communications, and how can they take what they've done their training in and have deep domain knowledge in, but blend it with communications. So if somebody's wanting to start off on that career journey, explore some options, part one of the question is, what are some of the roles that they might be able to fulfill with a background in the type of work that we do? And number two, how do you get going on that journey? What resources are available for training?
So I think communications is a common sense proposition. If you have common sense and you can write, or you're articulate, or you can create digital objects, engaging things, whether they're pictures or interactives, it's not going to be hard to break in if you have domain expertise, if you have knowledge and passion. And in fact, some of the best people on my team are physicians or public health, people who have public health degrees. And they just know more, and they're good at communicating. Now, just because you're a great scientist doesn't mean you're going to be great at communications. You have to have some gut level sense of how human beings consume information, and what gets people fired up or inspired or engaged or emotional. But I actually don't think it would be very hard to break in. I think that if you had a person like me, a hiring person, who was willing to sit down or read a resume or read an email or talk on the phone, and you said the right things, you had that right blend of intuition and instinct and eloquence, it wouldn't be hard to become a PR person at WHO or the Gates Foundation or something like that. I actually think if you're a PR person, let's say you're somebody who studied communications as an undergrad and you want to go into heavy-duty public health communications, that you're going to have problems, at least for me, because I need to see that you've lived in the world and done something. And actually, I mentioned that my daughter, who's 23, is in global health advocacy and communications. And I keep telling her, do not stay in global health advocacy and communications. Go to grad school. Go do something. And then you can always come back to it. And she's listening to me, actually. She gets it. I hope. And actually, after being with some of the young people last night, my husband and I were like, Sylvia needs to really go and do some of this stuff you guys are doing. And she has she's very good at science and math and so on. But anyway, so that's a long answer and the short answer is, I think it would be very easy for scientists to break into communications.
It sounds like there's an offer of an intern too in your daughter,
yes,
so
please,
if anybody
please.
needs.
Actually, we are hiring. We have vacancies because I'm shifting people into Ebola comms because this is a long-term proposition, unfortunately. So actually, if you know anyone in the room, outside, just send me CVs. My email is stern@who.int.
Amazing. So we'll open it up to the room. I'm not sure, do we have mic runners for this session? Yes, we do. Excellent. And I'll start with an online question whilst those of you in the room think of your questions. I'll start with, well, because of the Gates Foundation, we love evaluation. How do you evaluate the impact that your communication efforts are having?
So at Gates, we would set goals and measure, and there was a lot of measurement, a great measurement team. At WHO, we actually I have a person, an M&E person, measurement and evaluation person, but she's somewhat neglected. People forget, and then late in a campaign they go, oh, right, can you measure what we're doing? And So as part of my reorg, I'm actually going to strengthen the M&E function. I'm going to have her probably work for me, and because we're doing a lot of stuff, and we're just not, we aren't clear about what we're aiming for, what are our goals, and then we're not doing enough follow-up to measure. Now, all that said, there's measurement and there's measurement. And the thing about communications, some of it's just a bet. Some of it's a wager and you can't measure. So for instance, when you do media, you're working, the audience is not your audience, it's the media outlet's audience. And to sort of see how your media campaign is moving the needle, it's tricky. Some of it is just you have to trust that a society, that culture, that media is an integral part of culture, and that when you're engaging with journalists and through them you're engaging with those audiences, that there's an ineffable but actual impact on how people think and feel about things. Similarly, social media, you can measure engagement in many, many ways. Do you really know if you're converting people into being global health champions, or you're activating them, or you're creating self-efficacy, which is a term of art. You can show how things change, but whether it's really cutting through, it's very hard to prove. I had a conversation, I was on a call yesterday. I told Jen I got here and I had to then spend the whole afternoon on conference calls with Geneva. And one of the calls was about public health messaging. And I had a couple colleagues saying, public health messaging doesn't work. And I was like, well, that's a very big statement. And there's public health messaging and there's public health messaging. I mean, what are we talking about? Is it tobacco? Mm-hmm. Is it food safety? What is it? So even within our field, there's a real raging debate about what works and what doesn't. And yet we do it, and we need to do it. Yeah. It's tricky.
Yeah, I remember being at a National Academies meeting, and there was a debate around whether communications could be used as an effective behavioral change tool.
Yep.
Yeah, that was a tough one. Oh, we've got one over there, Caroline.
So something that we struggle with as scientists is the idea of communicating uncertainty. So much of the work that we do is probabilistic, and it's not, the science isn't certain, and projections are uncertain, forecasting is a difficult problem, all of these kinds of things. And I think a lot of the problems that we have as a community when we're talking to journalists is how do you convey uncertainty, whether it's in a map or even just talking with a journalist. And I wondered if you could help us understand from the journalist perspective or from a policymaker's, from the WHO perspective, what do we need to do to better communicate uncertainty and nuance?
Yeah, it's funny, I'm glad you asked that because I was kind of making notes this morning as I thought about the session, and a lot of time, my dad was a plasma physicist, and he would always grumble that reporters didn't understand physics, never got it right. He might have been right, he might have been wrong. But so I was thinking about that, and in answer to your question, I wrote down, take time with reporters. When you talk to reporters, take the time to go over things. And don't talk down to them, but talk to them and explain, look, here are the data, here are the forecasts, here's what we know, here's what we don't know. And you could even say, I'm worried that your audience, your readers, might take away some level of certainty that doesn't exist. In other words, talk them through it so that the reporter understands what the nuances are. I think sometimes we talk to reporters, we do it quickly, or we do it in sound bites, or we say, okay, you have 15 minutes. And when issues are really complicated, try to get a big chunk of time with a journalist, because that's really the only way you're going to ensure or help ensure that the resulting story or broadcast piece is contextualized and accurate. The other thing you can do, I wrote, is offer to review things. Offer to get back on the phone with a journalist and talk it through. So for instance, when I was a reporter back in the day and I was covering something complicated, I would always say to the source, hey, can you give me your cell phone number? That was, or before we had cell phones, give me your phone number. Because I'm going to want to call you back and run some bits of the story by you. Now, reporters in many countries, and most countries, you can't send a draft of the story to the source. Some countries you can, oddly. But what you can do as a journalist is get back on the phone and say, okay, if I describe this scientific phenomenon in this way, is that accurate? And then the scientist can say, you're conflating two things. So offer to discuss and rediscuss the complicated things you're discussing that you're talking to them about. So take the time and offer to loop back with them, and be upfront about the risks that are there, where you're worried that something will be misconstrued. Journalists, I have great faith in journalists. People go into serious journalism because they're certainly not to get rich. It's because they want to explain the world to their audiences. So they will be very receptive if you're available to them.
I always like CDC's advice too, because they've got a really good crisis and emergency risk communication manual, CERC, it's free, you can look it up online. And their advice was always be first, be right, and be credible when you're communicating in a crisis situation. And around the credibility piece, they said, if you don't know something, tell people what you don't know, but also tell them what you're doing to try to know. And that goes a long way, I think.
I mean, you have to be the first to admit a mistake. If you're an institution, you have to be the first to say what you don't know. I mean, absolutely. You don't want to appear false and defensive and sly. Absolutely. I always just say be yourself.
Yeah.
Because if you are your true self when talking to a reporter, you're going to be honest and you're going to be engaging and authentic. It's actually common sense, like I said before.
Yeah. It's good advice for answering questions after conference talks and during your thesis defense. So it's a little bit of advice for free. Question over here.
Hi, thank you very much. A lot of the approaches that people have talked about over the last 2.5 days are approaching a level of forensic detail in terms of reconstructing patterns of disease. Have you got any advice to us when you're thinking about stigmatization of disease and communication of that sort of information? Have you got any advice on what we should think about when communicating that sort of information, where it involves, say, regional or national borders, international borders, and so on?
Can you expand on that a bit? So when you say forensics, so give me an example of.
So I work on cholera, and we can trace the spread of cholera through East Africa up into the Yemen, for example. We can actually say roughly where it came from. At one point, there was a discussion of whether the cholera that was causing disease in Yemen actually originated in Iran. And actually, it didn't, and there are two different scenarios that when you talk about geopolitics, stigmatization, have huge. You think very differently about how you'd communicate. I just wonder if you've got any advice for us.
So is the question that if you were to lay out the trail of a disease from point A to point B to point C, that it would then result in people stigmatizing the original population, saying they caused it? I guess my view is if it's true and it happened, you have to talk about it. Now, you don't have to proactively talk about it if you don't want to, but if you're asked about it, you must. But also, I actually think people should know about, the tools that we have to trace things, because it all feeds into a story of prevention ultimately, right? Because if the point of origin had a robust health system, you wouldn't have the problem originating in the beginning. So perhaps the solution is to talk about it with sensitivity and in a way where you're not saying we're pointing the finger at whatever country, whatever community. We are talking about why do we map these things? We map these things both to better understand the current outbreak, but also to prevent future ones, right? So I think I think putting things in context and discussing them with sensitivity is the way to do it. But to not talk about things is a mistake. Because anyway, someone else will talk about it and they'll do it in a bad way. They'll do it in a xenophobic or nasty way, right?
I've got a couple online ones here that I'm going to try and blend into one Uber question, with the concept of the core of that Uber question being communicating with difficult communities like your anti-vax or vaccine-hesitant communities. So one of the questions is around what is the most effective strategy to use? So the person says in the question, people like to throw stats at this group, and I can tell you that's what we call the knowledge deficit model of communication. If you just give people information, they will draw their own correct conclusion. And time again, we know that doesn't work. So what are the better strategies for engaging with audiences, and how do we as scientists, the other question I'm rolling into this is we tend to like to, as Caroline said, cover the uncertainty and not be very black and white, whereas the communities like your fake news industries and your anti-vaxxers are very, it is this way or this way, there's no in between. So what are some of the approaches or strategies you can use in communicating with challenging audiences?
Yeah, I mean, it's tricky because there are difficult audiences, and there are difficult audiences. Some are beyond reach. Yeah. They're just you're never going to reach them. But then there are some whose beliefs may be rooted in religion, but they also love their children, right? Or if you present a human story, they will relate to it. Or you show that people in the village, one or two villages over had this experience. And I mean, we're doing this in North Kivu, right? And there's every day hundreds of Ebola response workers are fanning out and meeting with women's groups or community groups or schools or families and talking and sometimes they do dramatizations. The other day there was a drama that kind of illustrated some of the issues around the infection, about the outbreak. So you're right that just throwing data at people doesn't work, although you need to give people data because there will be people who want the data, but you need to also accompany that with real, factual human stories, people's experiences, how they got through adversity. It's really tricky. It's really tricky, and there's so much disinformation out there, you won't budge a lot of people.
There's a really good resource, too, if anybody's interested. You can go on the WHO's website, and somewhere in there, I can't remember the exact title, but it's something along the lines of Communicating with Vocal Vaccine Deniers, and it's a really great report. It came out last year, and it's about, I think, 40 pages long, and it outlines just general strategies for communication in general, and then coupled to, hey, if you're, dragged into a debate with an anti-vaxxer, what do you do? So good bedtime reading. Is there any last questions from in the room? Oh, yeah.
Yeah, hi. I guess a lot of us work in antimicrobial resistance, and I'm just wondering, how does your communication strategy for that differ to other things like Ebola? Because, there are sort of different time frames, there are sort of antimicrobial resistance outbreaks, but then it's like an ever-present problem, and I just wonder how you approach that.
Yeah, AMR is a big priority, and in fact, Dr. Tedros has kind of ramped that up recently. We have a new Assistant Director General, Hanan Balki, who's doing AMR, and we have Mariangela Samau, who's doing we have a lot of people working on different elements of AMR. But that's one of those areas that, especially in the West, they hear about it, but they still want their azithromycin. They want to do what they want to do. So I'm thinking about that a lot because we have on June 19th, we have an AMR-related campaign. We're launching a tool called Aware, which is going to be a tool for countries, for policymakers on sort of a menu of, it's a prioritization of different antibiotics and how they should use them. And it's very abstract and not very relatable to the average person or policymaker, right? I mean, unless you're in the field, it's not easy to understand or explain or care about. And it's a real problem. And also the animal health aspect of it. I don't think anyone has a solution. I don't think AMR issues are being that well communicated right now. And the other thing that happens is you have surges. So for instance, the big report that the Secretary General launched a few weeks ago in New York, we had like a spurt of coverage. New York Times wrote something, et cetera, but then it's gone, right? There's no drumbeat around AMR. So we're trying to create it, and that's going to be something my department will be involved in, but it's tricky. So send any and all ideas and suggestions.
Another plug for a good resource, there was a report that Wellcome funded, I want to say it was about 2 or 3 years ago, and it was about what the public understanding of AMR is, and it gives you really good insight, because communications rule number 1 is like know your audience, and it's a really helpful document to set out who is your audience when you're talking to the public, what is their baseline understanding of antimicrobial resistance. And one of the interesting things that I read in that was that a lot of people actually think that the resistance is referring to the human, like you're becoming resistant and not the microbe itself. So really, really eye-opening.
Well, fundamentally, the answer is better science education.
Yeah.
But that's a long-term proposition. But actually, that is the answer for so many of these issues. If people had better educations, we wouldn't have a lot of these problems.
That's true. I will finish with one quick question from online. It's the question about a question. And it was, if you are about to interview somebody new and important and super cool on something like a podcast, what would be your go-to question?
You mean me as a journalist?
Yeah, what's your favorite one to ask?
As a journalist?
Yeah.
And about global health?
About
anything?
Yeah.
You mean who would I want to interview? Let's say I'm
what's
Mike.
your
If I'm Mike
go-to
Barbaro of the
question?
New York Times, huh?
What's your go-to question?
Oh, you mean if I'm doing a profile of someone?
Yeah.
What keeps you up at night? That is the best question, because then you really find out what the tension is and the conflict and the thing they're worried about. That's the best thing. What keeps you up at night?
So what keeps you up at night?
Oh. 2 things. One is the Ebola outbreak. We have to end it. And to the extent that communications can help populations on the ground be more receptive to the vaccine and somehow end the conflict there, because it's really the violence that's hampering the outbreak. and ensure that global audiences understand what is and isn't happening. So that's one thing. And then the other one is I have a department of wonderful people who I need to empower. I need to make them happy so that they do great work. And it's really hard. Managing people is really hard. And I worry about my people. That keeps me up because I don't want to fail them. So that's it.
Amazing.
And my children. I worry about my children.
I think all parents do. Everybody join me in thanking Gabby for a fantastic conversation.
Thank you.